and welcome to the first episode of Safe and Sound, ThePrint's new limited episode online video series on mental health during the ongoing COVID-19 pandemic, presented by Facebook. Our first guest today is Ruchita Chandrasekhar, who is a behavioral health researcher and an independent psychologist. We also have with us Omar Baza, who's a clinical therapist based out of Toronto. Hi, both of you.
Hi.
Hello.
Thank you so much for being here with us. Ruchita, may we start with you? Could you tell us a little bit about the work that you do?
I'm a behavioral health researcher who works with organizations and also works on independent research that tries to bring the intersection of mental health, sociocultural issues, all of it within the public health space. I'm also an independent psychologist who does one-on-one clinical sessions online and workshops whenever I can.
Okay. Omar, can you tell us a little bit about what you do, please?
Yeah, so I work full-time in an agency funded by the government of Ontario here in Canada. So mainly I provide therapy to youth ages 8 to 29 who are in underprivileged parts of the city or who don't have access to mental health services. And I also do pro bono work on Twitter and do private sessions part-time as well.
Okay, great. So I thought we could jump right into it. The first thing that I thought we should probably talk about is that, of course, we're right in the midst of the COVID-19 pandemic. Could you both tell us what mental health manifestations are occurring because of the pandemic? What are the kind of mental health issues that you're seeing in your patients and other people who are approaching you? And what are some of the most common symptoms that you've observed? Ruchita, please.
So it started differently and now it has transitioned differently. I think at the beginning, there was amplified anxiety. There was a lot of confusion, a lot of helplessness, and all of those things. And then now it has also transitioned to a point of desensitization and numbness, but also mostly exhaustion. So say if it started with these like escalating symptoms of anxiety, those still persist, but they look different now. But the depressive symptoms have started acting up more. I think also because the weather's changing, people have, remained contained for a long period of time. And one thing I've realized is that depending on where you live geographically and how the pandemic is affecting your area, people's emotional health is getting affected accordingly. So I noticed that once a few countries up north, like in Europe, even parts of Australia started opening up a little more, people were able to access their regular coping skills a little more and felt a little better for a short period of time. Whereas people within South Asia, within even Pakistan and mostly India and parts of Sri Lanka that I work with just felt continuously helpless and also angry that they had to be under this really strict lockdown. They weren't understanding what was happening, what was the purpose of all of this. People were losing jobs more rampantly because the economic crisis of all of this also hit. So I think the transition has looked very different. Now, what I mostly see is exhaustion and burnout. And when does this end? And also like scary levels of apathy, because people are just getting to this place of like, well, whatever happens, I'm still going to go out because I'm tired of being inside all the time. And of course, there are personal losses. There's the larger systemic issue, and then there is a pandemic, and then there are interpersonal issues, and people can't access their regular coping skills. So I think it's just spanning across different types of issues for now. Mostly exhaustion, though, is what I'm seeing.
Could you explain a little bit about the behaviors that each of these symptoms tend to display? Mm-hmm. You first mentioned escalating feelings, and then you mentioned depressive feelings, and then now exhaustion. So how does that manifest in people? How do people behave?
I think the first thing that started getting affected, and usually also starts getting affected, is appetite and sleep and social relationships. So again, at the beginning, it looked like sleeplessness was big. Appetite changes also looked different. A lot of people reported that they were binging more, they were eating more, and then a lot of them were just like, I just can't eat. And I think it also depended on how their interpersonal stressors were impacting them. Jobs were being lost, folks were passing away, a lot of those things like that. Screen exposure has increased, substance use has increased. If a lot of this like online interaction with people was a lot at the beginning, Now it seems like interpersonal interaction and just having people around you and not having people around you is impacting people as well.
Right.
The inability to go outside is getting to people. So now the coping behavior that they're trying to engage is, at least I need to be able to go to the terrace. I need to at least be able to go take a round in the park outside. So yeah, different ways like that, if that explains it.
Okay. What about you, Omar? Could you tell us a little bit about your experiences during the pandemic?
And I completely agree with everything Rushda said. I think it's very on point in terms of my experiences as well. But I would say also just giving up. So at the beginning, we were very compliant with the lockdown rules, and we kind of wanted COVID-19 to go away or to be kept under control. But the more it extended, the more those rules kept weighing on people in general, and they were more likely to start disobeying those rules. And that helplessness point where it's just, okay, I'm done, I cannot do this anymore. And so we've seen more people just meeting with friends, kind of trying to go back to their life that they had before. But that doesn't get rid of the anxiety that they're experiencing because COVID is still there. And for a lot of those people, they know others in their family or friends who've been impacted by COVID. And so it's at the back of their mind. So they try to chase that reality that they had before, even though it's not the same at all. Another thing is also just an increase in depression, anxiety, trauma, depending on circumstances. So you have some individuals living alone where loneliness really caught up to them. And that loneliness led to very strong symptoms of depression, sometimes even suicidal ideation, especially for those of us who live abroad or not in our home countries. And so it can be hard to worry about our families back home and also about ourselves and our situation as it's happening.
Right.
And I think the biggest part of it is the uncertainty, because at the end of the day, we don't know where this is going. We don't know when the vaccine is going to be available, when we'll be able to go back home or anything like that. So even stable jobs that used to be like that before are no longer stable now. And all that uncertainty from all these different angles, different areas of life are really weighing down on people a lot. And then you have the opposite side of the spectrum where people are stuck with their families and toxic behaviors are emerging even worse than before, whether it's with parents, partners, things like that. And so being stuck in a home 24/7 with the same people, I think even in the best of circumstances can be very hard because we all need that private space. But when it's not there, we're more likely to be angry, and that anger can really come out in very destructive ways as well.
Right. You did mention being both stuck alone as well as stuck with other people. So those are some contributing factors to triggering, would it be appropriate to say deteriorating mental health? It triggers the deterioration of mental health?
Yeah, absolutely.
Is what we're observing.
Yes, and it can deteriorate or it can start also. So we've had people who maybe had some mild anxiety or depression that became more severe during the pandemic, but we've also had people who've never experienced anything related to mental health symptoms kind of develop very severe symptoms as well. So I would say that along with the pandemic that we're experiencing, we're also experiencing a sort of mental health pandemic as well. And this pandemic of mental health is going to stay even longer than COVID ever will.
Right. And what do you estimate the numbers are like, in terms of both, say, in your personal experiences, the number of patients you've had before and the number of individuals who seek out your help now, as well as what you generally observe, both with other professionals as well as on social media through your work and things like that? How is it climbing?
It's staggering. At my agency, all of us are fully booked, to the point where I've never had a waitlist before because I try to accommodate all clients that I have in my full-time job. But now I have to have one because it's just not possible anymore to keep taking on new clients. And I think the quality of service also suffers across the board when it comes to our agency, because you know that there are so many people waiting. And so there is that pressure to treat even quicker or to provide that faster service. But whenever that happens or whenever we're feeling overwhelmed, that can take a hit as well in terms of the quality of service. And so I think even in a system that's more advanced, like here in Canada, where there are free mental health services, it just showed so many gaps that we didn't know existed before. And I really hope that these gaps are going to be recognized and just fixed for the long term as well.
Right. And this is sort of like a feedback loop as well. The more the pandemic rages on, the more people need help. And the more the people come in, the more the system gets overwhelmed, just like it does in regular hospitals too.
Mm-hmm.
Yeah.
Absolutely.
Right. Ruchita, what is your experience been with with the growing numbers?
I think, there's been a wait list for a while. Every week I've reached a point where every week it's about 10 to 15 people who reach out. I see 50 people a week at this point, which is already a lot because I'm at 10 clinical sessions a day a lot of times. Goes on from 8 a.m. to 11 p.m. Just is back to back a lot of times, along with the other stuff that's happening. So it's like 10 to 15 people additionally reaching out, that I've just created this email where I have some other resources of people who said they can provide services, and I just give it to them. And I'm like, I can't take you on. These people might be able to. So it's like a relay race at this point. You just keep passing the baton, like whoever can take you on will try, because people are developing newer mental health issues and whatnot, but people whose mental health issues had gone into remission have also come back.
Right.
And they're remaining in their severity as well. So people who have been out of therapy for a while, who've been off medication for a while, all of a sudden now feel like everything's coming back. I thought I'd already worked on this. Why is this coming back? Like, why is something that happened to me when I was 12 years old triggering me right now at 25 when there is nothing to do with that altogether? So the numbers are, as Omar said, staggering and alarming, and it just keeps increasing.
Right. Would you think when we look at the root causes for increasing anxiety and these kind of behaviors, would you think it would make a difference had there been just one or two uncertainties versus right now where we don't know anything about the virus, we don't know about the vaccines, we don't know about drugs, we don't know about our family members, our friends, jobs, work, inequality. There are so many things happening at the moment. Had this been a limited crisis, do you think this would have been more manageable in terms of, the ongoing and the upcoming mental health crisis that is coming? Does the sheer number of factors in uncertainty exacerbate the situation?
I think validation for mental health issues is already absent in this cultural context, which makes things much worse. So I feel like people have had 1 to 2 uncertainties and still struggled because they have a difficult time recognizing this as a health concern and then finding support for it. And I don't mean support just in the sense of clinical therapy, because there aren't as many resources in India already. But even if I was feeling anxious and I was to go and tell a parent that I feel anxious, the first thing I'll be told is not to feel it.
Right.
So that's what we're working with. And then now you add the additional crisis and the additional uncertainties, where this is normal at this point. Baseline mood is anxious. Baseline mood is feeling depressed already. And you add the additional invalidation. This is all nothing. Your generation is taking these things too seriously, kind of discourse around it. It makes things that much worse. So I agree with you that if it was just few things and not as many things, maybe it wouldn't have been this bad. But there is a part of me that also wants to argue that it's always a few things. Nobody's life is perfect. You always have something going on. There's always some kind of stressor. And stress is a natural bodily response. And we live in a cultural context where people are consistently told, don't take stress. It makes no sense. You're not taking any stress like that. You're exposed to stress and your body responds. So the absence of validation, the absence of a larger systemic dialogue around this is normal. Like if you feel angry because something has happened, it's okay to feel angry. It's not like you're not supposed to feel it. When you're bred into a culture and grown up in a culture where you are not supposed to have some emotions, and those become your dominant experience in a time of crisis, it gets that much more challenging.
Right. Omar, how would you contrast this with cultures, suppose like in Canada, where people are more open to talking about mental health in general with their families and peers and in society?
Yeah, I mean, even though it's more open, it's still not that open. And so even if we take the example of our communities who live here in Canada, most of the time, the culture that's applied at home is still the same that would be applied back in our countries. And so what tends to happen then is that there is no talk about mental health, no awareness of it. There is still that intense pressure for studying, sometimes emotional unavailability, or even some signs of abuse within the household. And that ends up leading to a lot of repressed emotions that tend to come back later on. And so then we have a situation like the pandemic happening, and it acts like a catalyst. And all those things come rushing out really fast. And that happens with people from all ages, even children, which usually I wouldn't, like even in my practice with the government, usually I wouldn't see kids a lot under the age of 12 because they wouldn't usually experience a lot of these symptoms. But now we're starting to see younger and younger kids coming with anxiety and depression and things like that. And so it becomes even hard, even when you're trying to be open with them as parents or family members, it's really hard to kind of tell them what they're experiencing, because even developmentally, they can't really understand what's happening. And so there is that added element as well. But, even within, Western white culture, there isn't much of that openness talking about mental health. There is always some of that embarrassment. There is always that barrier that happens. And even when parents try to be open, it's really hard to kind of provide that right advice or that right listening, understanding skills. Right. Parents always end up saying something wrong at one point or another that kind of takes the kid back towards a phase where they don't want to share anything. So, and I think a lot of that is due to a lack of prevention. And I think that has been exposed even more now because it's not something that we learn about in school. It's not something that there are workshops about. And so we end up kind of solving a crisis rather than preventing it. And I think had more work in prevention been done already, there would have been more awareness, and perhaps we would have been able to kind of contain a little bit this mental health outburst that's been happening lately.
Right. And there's more to happen as well as, things become more and more contentious with both vaccines and drugs and treatments. And in other countries, the winter wave has come in, the second wave and the third wave. So going forward, now that we're expecting it might be like this for the next, say, 2 to 3 years, as individuals, recognizing that our mental health could potentially be affected or be affected more, what are some things that we should watch out for at the situation that we are in right now? What are some societal triggers that we should watch out for? For example, if someone is staying with their parents and they're okay right now, it might eventually lead to conflict in the future. So these are sort of things that people have to anticipate while living through this pandemic. So what are some other things that we might need to anticipate, assuming that we have to live like this for the next, say, 2 to 3 years?
I'm concerned about how much how many somatic issues or somatic concerns as well this chronic stress exposure is going to bring, because chronic stress exposure is related with inflammation. We're already seeing a rise in people having migraines, people's autoimmune diseases being flared up. So I feel like those health concerns will start acting up more and more, acidity concerns, digestive issues, however it is that your body starts physiologically responding.
Right.
I think that's going to increase. I'm already seeing a rise in it. And again, the lack of education around this is how stress is linked to it. This is why this happens is absent. So in a time when our bodies are wired to be afraid of a fever, if we start having any atypical symptoms where we're like, I didn't have this in April, why am I having so many issues now? As scientists discover that there are some unique COVID symptoms coming up, like I have a friend who developed conjunctivitis because of COVID. And apparently that happens in 3% of people is what she was told. So I'm concerned about the kind of panic and anxiety that will set in when There's a somatic concern that comes up because of the chronic stress exposure. And then the fear around it and difficulty managing it probably, while also living through a pandemic where we're so scared something's going to happen to our bodies and we're afraid of death overall. Right. That is one. When it comes to relational concerns, when it comes to family dynamics and things like that, I don't know, because this is looking different more and more. And what I'm seeing right now is more numbness. And I'm just seeing people lose their energies. And I would hope that gradually we're able to also take this conversation into identifying factors of resilience. What has worked for you in the last 6 months? Because if we've made it this far through the distress, something's worked. Something's absolutely worked, right? It's pure cutthroat survival at this point, but there is some things that we've already put in place. So I'm also hoping that the dialogue can, within individual settings, within just larger family contexts, wherever it is that we can normalize these conversations, can graduate to what are factors of resilience? What has worked for you so far? How can you take that forward? When do you decide that it's time to just take a beat and to just wallow in how you feel and just be angry about all of it and then be able to just take care of yourself through it as well? Right. I think there is still a lot that is unknown. But operating from the assumption that, this is going to keep feeling worse for a while, and these are the supportive things I can put in place to take care of it, is bare minimum. And I think we need to set realistic expectations accordingly. Happiness is not a goal. Feeling fantastic is not a goal. Getting through it, that's it. Surviving. I remember the beginning of this year when everyone was big on, I want to feel productive. I'm not able to do this. That's not the goal this year. The goal this year was just to make it out alive. Right. That's done. The goal for next year, I think, is also going to be just living, making it out alive. So I think managing those expectations will not be linear. We're all, again, raised in a very capitalistic world where we feel like we have to be machines and anything we touch has to turn to gold and feel fantastic and happiness and motivation. No, I think we need to scale that back down, and that won't be a linear process as well. So somatic concerns, factors of resilience, functioning within the unknown, or we don't know how this is probably going to graduate even in the psychological health spectrum. And just knowing that the process is not linear and expectations have to be realistic.
Right. What do you say, Omar? What do you think we should anticipate going ahead, both as what Ruchita described for the public in general, and even as individuals? What should we as individuals be expecting?
Yeah, and I think that's really, really hard anticipation. So many things that we had anticipated didn't happen. All plans kind of went away for this year. Just make it through that 1 minute and the next minute. And it's not the goal just for the regular population. It's the goal for us as well as healthcare providers. It really is survival at this moment because, we've been at this for so long now. And it takes a toll on everyone. But there are some things that we can try to do to maintain a sense of normalcy. And I think one of the first things is self-care. Even if things are really hard right now, going for a small walk if it's safe outside, or there are not a lot of people, talking to a friend on Zoom or watching a movie with someone, I think is going to be very important. And even more meaningful right now, externalizing. Don't repress your emotions as much as possible. Please share what you're going through. Right. Create a Twitter account and share it into the void, even if no one is following or no one is looking at what you're writing. Don't keep it inside, because the more we repress, it's like a pressure cooker and we keep adding ingredients to it. At one point or another, that pressure cooker is going to explode. Right. And so we need to externalize emotions as they come. Journal, talk to someone, write online, write a blog, an anonymous one, whatever you want to do to externalize. Cry. It's perfectly okay to cry. And it's a great way of externalizing. But I think those two things, self-care and externalizing, doing them on a daily basis becomes even more essential now.
Right. And I guess going forward, we're also going to have to probably start with dealing with more number of deaths among people who are closer to us as the disease increases and inches closer and closer. Ruchita, I know you work with people who've gone through trauma. What do you tell people about how they could deal with grief, especially during a time where you're likely separated from your loved one who's passing away? You might be in a different city, or even if you're in the same city, you might not be able to make contact, give them a hug, or touch them. So in situations like that, how does a person deal with the trauma, and how do they accept and digest the situation?
What I highly encourage for folks going through something like that is having people around you. Whether or not you talk to them, avoid being alone in a home as much as possible, especially folks who live outside the country and can't come and have to see their loved ones one last time on FaceTime, on Zoom, on WhatsApp video and things like that. There's a lot of shock, numbness, and I don't understand how I feel. You don't have to understand how you feel. It's okay. Mm-hmm. This is how it feels. This is what this is. It doesn't even have to have language to it. But don't be alone through it. Someone can just be around as like background noise. You don't have to talk to them if you don't want to, or you can watch something with them. If you are not ready to process your grief, to start talking about it, that's fine. But as much as possible, avoid being alone, because that can increase how much more overwhelming it feels and how much more isolating it is. Like Omar said, externalize when you can. You want to cry into a void, cry into a void. You want to scream, you want to do anything. The language of your grief is going to look different now because there's so much more attached to it. And I think a lot of this is about allowing yourself permission to feel it the way it comes.
Right.
And having people around you, having a support system.
Right. Omar?
Yeah, I completely agree with everything Ruchita said. And I think the grieving process is a very personal one and is going to look different from each individual. And what I find has been a barrier as well for people who are grieving is that there is a lot of judgment going around. So whether it's because they're taking too long to grieve or too short based on some kind of society expectations. And I think that that's taking a toll on their mental health as well, because they start to feel guilty about whether they didn't love that person enough or whether they, have something more wrong going on with them. But it's important to remember that grieving is very, very individual. And out of everyone that I've met and done grief therapy with, or dealing at least with their grief in a therapy setting, not two people have had the same type of grieving.
So one of the last things that I wanted to talk about is staying safe now during the pandemic. We understand that we have mental health crises, and we also understand that we have to be prepared, and there are a number of things that we can do. So I wanted to talk both about staying safe mentally as well as staying safe physically from the virus. About the latter, Ruchita, you had also mentioned that there is a lot of desensitization right now, and everybody is just tired of the virus. They're tired of the news. They're just tired of being at home. And then the sense of fatigue eventually leads to complacency, where people just give up and just, go out and have this fatalist attitude of, if I get it, I would get it, which of course is not a healthy attitude. So how can people keep mentally reminding themselves to still be on the watch out for the virus and to continue persevering with those stringent distancing measures?
I think it might help to first recognize that some of this fatalistic attitude probably also comes from an irrational thought that's fueled by, if I get it, maybe it won't be that bad. I'm young. Like the kind of bargaining that happens through the process that leads to that conclusion of it's fine, you can go and do it, is also fueled a lot by denial and irrationality and things like that. So going back to resources and reading, of course, is one. But two, also having a bargain where it doesn't cause harm to someone else. It's not just about you not getting it. It's about someone else also. So if you need to go outside and you feel like it's getting really suffocating, see if you can go to a terrace when no one's there. See if you can go to an open space or if you have a car, drive around, keep the window open, things like that. I think there's difficulty in reconciling with this is all some of my outside coping skills can be for a while. But I think the emphasis being on for a while. This is it for now. It is survival. Like I said, like realistic expectations. And I think that's something, holding each other accountable is something we will just have to do for each other. So I'm hoping that we'll be able to hold each other accountable then and see what is doable with minimal risk, because everything has risk at this point.
Right. Omar, how do we keep ourselves, how do we keep reminding ourselves that we have to stay safe, even though we're completely fatigued with all these impositions that we have?
All the mental health issues that are arising, there is also a lot of boredom. And when we have to stay in the same place or have the same kind of day every day, boredom is going to come across. And especially it has been going on since March now. And every day looks the same. Even on social media, everyone is saying how every day of the week looks the same, whether it's, Monday, Saturday. And so that creates a lot of, it can exacerbate the depression that we're already experiencing. Then we have also introverts and extroverts. And obviously, extroverts are going to be impacted even more by lockdown measures because they feed off that energy from others and they need to be with other people. So they're going to have a harder time of it. And they're, more likely to perhaps try to seek that comfort outside of home. And, even if they have to break a few rules, obviously it's not general. Not every extrovert is going to do that. And also some introverts are going to do it as well. For example, I'm very introverted. So I haven't had a hard time staying at home. But at the same time, I miss my family. There is a lot of that happening. And I think even governments have started to give up a little bit. When we look at the first lockdown that happened in March, April, it's very different from the lockdown that's happening now. The US, for example, has given up. A lot of countries in Europe are going unchecked. Countries in Africa are doing the same. Canada, even Ontario.
So the last thing I wanted to ask both of you is that you mentioned a number of things before. Omar, you had mentioned journaling, and Ruchita, I think you had mentioned exercise. So I wanted to ask you, going forward, for your mental health, what are 3 of your favorite daily habits that you recommend people should start to sort of keep themselves grounded and focused a little bit, and potentially something that could help them?
I suggest having something to look forward to at the same time every day. It can be something small, but something that you like, something that is engaging, or actually even it could just be a nap also. Something to look forward to every day. Because it, like Omar said, like each day has felt the same. So this brings a sense of like, okay, at least I know what to expect, and I know to expect something I will like and look forward to. I also highly suggest being in tune with your body and engaging with it every day, because I think we just, like the numbness and the dissociation, all of this happens is also a lot about disconnecting with your body and not taking a toll with how tight your shoulders are. Maybe you've been shallow breathing for 5 days altogether, and that's why you've been feeling so amped up. Your knees are probably hurting. So you're not sleeping well. So I think being in tune with your body, checking in with yourself, even if it takes like, I'm a big advocate for something called diaphragmatic breathing. Diaphragmatic breathing can show you a before and after of how your body's been. So I think for folks who are already struggling, I would suggest having something to look forward to every day that is small. And if you feel like you need help and help is accessible to you, please reach out. It's okay. It's absolutely normal.
I also think that one of the important things that we're going to have is to just take it day by day. So don't plan too far ahead, whether it's, 2 weeks from now or a month from now. I think it's just about looking forward to the day that you're experiencing and having something in the near future that you want to do. For example, I've come to really enjoy my morning tea even more now because it's a process. It's a process that used to take 5-10 minutes, and now I stretch it to about an hour. Maybe try something new. Maybe not a new skill, because that can take a lot of energy, but a new book that you wanted to read. Even if you just read one page a day, a new movie, a new TV show. If you don't have a lot of energy that day, just stay in bed and watch something on YouTube. Just deep breathing. Those are all like low energy coping mechanisms. And so depending on how you feel, you may do low energy ones, and then the next day you're going to feel better and you're going to go for a walk, like that high energy coping mechanism. And that again brings it back to Rashita's point of being in check with our bodies, because our bodies are going to tell us how we feel that day. And generally, like within half an hour of waking up, we kind of know whether our mental health is going to be good or bad that day. So, just take it easy. Be patient with yourself. You may not feel happy for a while, and it sucks so much. But at the same time, you're going through your day, you're using your coping mechanisms. If it improves things by 5-10%, it's a huge victory, and we're going to take it for now. So, lowering our expectations just a little bit more can be very helpful as well.
So lower expectations, take everything day by day, be social and talk to people, do small rituals for yourself, try something new, try something at the same time every day, and keep in tune with your body. These were the things that you both mentioned. Wonderful. Thank you so much for being with us here today. Omar, thanks for staying up for us. And Ruchita, thank you for waking up early for us. It was wonderful speaking with both of you. Your comments were extremely insightful. Thank you so much.
Thank you, Sandhya.
You're welcome.